42 ends. Let's bring in Chad Wolf, former acting DHS Secretary and Executive Director at the America First Policy Institute. So CBP has released some new statistics on how many people they've had to rescue and how many have died crossing the border. Let's put it up on the screen. 2020, there were 12 rescues and 10 deaths. 2021, that number jumped to 688 rescues, 39 deaths. So far this year, fiscal year, 294 rescues, 16 deaths. Not surprising, I imagine, given the amount of the increase in cross-border traffic. But also people are saying, well, it's that 30-foot high wall now. People are falling off of it and they're dying.
Well, I don't think this is any surprise when you have the numbers that we have month after month after month, and April was the highest month we've ever seen on record. So when you have those number of individuals trying to cross illegally, you're going to see more and more deaths, unfortunately. You're going to see more rescues. Unfortunately, we're also seeing more assaults on Border Patrol. We have the highest suicide rate in the Border Patrol. So there's a number of records, all bad records, that we are breaking each and every month as this crisis continues to happen. What I would say on the border wall, look, Border Patrol needs something that will stop individuals, or at least provide that impedance and denial so that they can apprehend these individuals. But all those folks that are illegally scaling the wall or somehow trying to defeat the wall, they know what they're doing, and that is breaking the law. So at the end of the day, so look, again, the cartels have a disregard for human life. They're going to try to push people across, whether it's across a border wall system or in very dangerous and desolate parts that Bill just showed as well. They're about profit and profit only. But this administration, through their policies, are encouraging more and more and more of that. That's why you see those numbers. They're record high. We've never seen those numbers, the deaths, the injuries that we've ever seen before. So it's a direct result of the numbers we're seeing every month.
And it's also the case that once the U.S. government takes foreigners into custody, they are then responsible for their health and well-being and for protecting them, essentially. Take a look at this. This is reporting from the El Paso Times. They say that the El Paso Medical Center has so far this year spent nearly $14 million, I guess $2.7 million in reimbursements, caring for the health and well-being of migrants who have crossed the border illegally. What is that about? Are migrants getting sick at a higher or faster rate than they were last year?
Listen, again, all of these numbers just get magnified. So there's always been this healthcare infrastructure along the border that takes care of these illegal migrants. Once they're on U.S. soil, it's then up to U.S. healthcare officials to take care of them. They don't have insurance. So a lot of them that get released into communities, I think this is important to keep in mind. If you and I get a sniffle, we'll go to the doctor, we'll get antibiotics. They usually go to the emergency room. And so that starts to add up. They don't have health insurance, so they go to the emergency room, and they're told not to be turned away from emergency room care.
Right.
So this starts to add up time and time again. But again, when you see numbers, and when you see 100 and I think it's 1.2 already this fiscal year, or almost 1.3 this fiscal year million that have been coming across that border, the vast majority have been released into the country. You're going to see more and more of these numbers. Infrastructure, public education infrastructure is being strained. Obviously, the healthcare infrastructure is being strained, and on and on and on, because it's not built for this. It's not built for this overwhelming number of individuals coming in.
I think the main point in that El Paso Times article was that the University Medical Center is losing money, and of course that those are costs that are being passed along to other patients.
Yeah, absolutely. I mean, so, these are costs that they have not planned on.
I want to quickly ask you about this because we only got a minute left. 4 days away from Title 42 being rescinded. Let's just take a look at the border crossing numbers. This is 2022. April, 234,000 people. March, 222,000 people. February, 165,000. January, 154,000. May is expected to be even worse, but what do you expect June is going to look like?
Well, June's going to be even higher than April and May, right? So the numbers are going to continue to increase because the cartels have been given the demand signal, again, by this administration that they gave them a 6-week head start. Title 42 is going to end in 6 weeks. So you've already seen the increase. All you have to do is, once that is advertised, as the U.S. government has done, they have advertised that, it starts the demand signal, and you start seeing more and more individuals. But again, what's embedded in that 234,000 number is, if you look at the data, the vast majority of them, over 80 to 90%, are being released into the country. And at the end of the day is going to continue to see increases in the numbers.
All right. Chad, great to spend time with you. Thanks for coming in.
Thanks. Well, President Biden's